Okay, so today's topic is going to be infertility, and I think the inquiries are more along the lines of what do you do for infertility in the alternative or non-medical world or functional world, if you will. So, if your infertility is not pathology, okay, if it's not tumors or you have to have your uterus scraped or any of the things that could cause maybe your pituitary to not talk to your ovaries properly. Your pituitary gland is what's telling your ovaries to make estrogen and testosterone. That if it's not a pathology, okay, then it's really poor function overall of the woman's physiology. If it's not the male, most of the time it's the woman that's coming in here when we see these types of cases. But the same thing I'm going to tell you for females really applies to male physiology too. Basically, what usually happens is there's an imbalance, obviously, in your female hormones, your progesterone and your estrogen, and your testosterone. Well, and for sure, because a lot of times high testosterone is the cause of infertility. High estrogen can be the cause of infertility. And most of these situations are caused by too much estrogen and or too much testosterone. So how does that happen? It usually happens by lifestyle, food, these types of things. And what ultimately, if someone comes into my office and they're they're not having their cycles, they're not having their periods are all over the place, they got heavy bleeding, they got light bleeding, they got cramping, they don't have cramping. It doesn't matter almost to me, in a sense that it's good to know which symptoms that they have, but at that point in time, it's a matter of they've usually been to the fertility clinic or they've usually been to their doctors and gotten hormone therapy replacements and stuff like that. And so that usually tells us more that it's not a pathology, that it's their body not working properly. It's usually poor liver function, poor gallbladder function, poor intestinal function. It's usually a combination of those with blood sugar fluctuations, adrenal gland dysfunction, which is significantly affected by chronic stress, poor essential fatty acids. Each one of these areas is involved in imbalancing the hormonal production in your ovaries and actually also in your adrenal glands. Your adrenal glands are kind of your backup sexual glands. And so what usually happens is through a variety of lifestyle and dietary and stress imbalances, maybe people are taking birth control pills, and estrogen tends to build up. Your body uses it. Your body uses hormones. Then there's waste products, kind of like the cell takes the hormone in, it uses it, the cell's like a little factory. There's hormonal waste products, whether it's estrogen or progesterone or whether it's testosterone. It goes to the liver to be cleared out, goes to the gallbladder to be cleared out. There's a beta-glucuronidase in your intestines that's supposed to clear it out. It doesn't clear out. That reconstitutes unused estrogen, and this happens in your intestines. If this whole mechanism is not working properly, what happens is you're not clearing out the estrogen. You're not clearing out the estrogen in your liver. You're not clearing out in your gallbladder. Maybe, and that can cause you to have too much estrogen still in your system. Or maybe you're clearing it out there, but maybe you have a bad gut problem, and it's causing the beta-glucuronidase to actually reconstitute estrogen that's supposed to be going into the toilet because that's where it's cleared into. And now maybe you're making too much estrogen and you have an estrogenic problem. You can, as far as blood sugars are concerned, it's hard for your hormones to be active properly because blood sugar has a lot to do with converting your hormones properly. And if your blood sugars are off, and it's particularly if you have prediabetes, insulin resistance, if you have these things, this is where the blood sugar comes in even more so because insulin resistance, without getting into the whole chemistry of it, causes you to make more testosterone if you're a woman. And and if you have that making more testosterone, and it could even cause you to make more estrogen. But if you have the insulin resistance making more testosterone, you have your liver and you have your gallbladder not clearing out your estrogen, or you have your gut reconstituting estrogen that should be going into the toilet, you have an imbalance. You have an imbalance in estrogen and testosterone and progesterone too. And then your secondary sex glands or your stress glands, your adrenal glands control your secondary sex hormones. If you're stressed, then you're not making those secondary sex hormones. If your body's stressed because you got infections, whether it's mental stress, so it's basically blood sugar, adrenals, essential fatty acids. Those of you who don't eat enough nuts or fish, or you don't take fish oils, the essential fatty acids are critical for all hormones to work properly, because hormones have to be made, then they have to go to the cell. This is your cell, and they have to tap on the door and go, open that little receptor and let me in, okay? And if that receptor is not working right, then it doesn't let the estrogen in. Now you have an estrogen imbalance. What helps to let that estrogen in? One of the things that dampens inflammation and controls blood sugar and allows those receptor sites to be responsive are fish oils. So when someone comes in for infertility, it's the first thing we do. First thing we do is clean them out. We detox them. We look at their gut. If they have anything in their gut, and there's only about 35 different things that can be going wrong with your gut. So we look at their gut, see what's going on there. Gallbladder and liver can usually be included in that. You have to kind of get that under control to see what their blood sugar is doing, and then you have to look at their essential fatty acids. You have to look at their adrenals. But I tell you, sometimes we put a person on a general detox to detox all the chemicals out, and just to get the excess estrogen out of there that we know is there because of the person's symptoms and blood labs. And a lot of times, we've had people within a couple of weeks get their periods back after not being able to have a period for 3 years, after having gone everywhere and taking hormone replacement and stuff like that. I have a staff member here who every time we put her through this, because she's not good at staying on her program, she gets pregnant every time. So we told her she can't go through the program anymore. And but there's that baseline. That's a baseline, okay? And then if that produces positive effects and the liver's doing better and the gallbladder's doing better, intestines and adrenals, blood sugar, all that type of stuff, and now the person's still having imbalances, now you can start to really attack those imbalances directly with a number of herbs and botanicals that are effective. And I've had people come in and say, oh, I've already used those herbs and botanicals. They didn't work. Well, they didn't work because your liver was bad. Your liver wasn't clearing properly, your gallbladder wasn't clearing properly, et cetera, et cetera, et cetera, et cetera. All the things that we just talked about were there. So from that perspective, that's kind of the general template of functional medicine as far as the endocrinology of infertility. And again, if the person doesn't have an actual, like a genetic pathology or tumors or cancers or something like that clearly altered physiology, that is probably not going to respond to lifestyle changes and cleanses and supplements and dietary changes. Well, that person's not going to be the person that is going to have a good response with functional medicines. So that's kind of like the cliff notes of fertility and functional medicine.